Now I will tell you about the glove box. The glove box is very important in order to inactivate the sample very clearly without having a problem of infect yourself. The thing here, the glove box, you have two options. Either, especially in this part, if you need an electricity like us, then you need to pass this small wire through this hole. You can do it because you will have with the glove box, it comes this screwdriver where you can really use it to open this one and enter the wire into the glove box. This is the first thing you do. If you don't need electricity inside the glove box, it's good you can close completely this one and you don't need to have the holes for the wires. This is a very important thing in the glove box. The first thing you do in the glove box is first you put your equipment inside. And for putting the equipment, we need to put, for example, we will need the 100 microliter filter tips and the 100 microliter automatic pipette. You need to put the heat block, and of course heat block need to connect it to the electricity, and this is very important. And here we have the electricity cable where you can connect this and you will need a vortex, and for that also you need to connect it to the electricity again inside the glove box. In addition to that, you will need a wrap, of course, to hold your sample into it. You need the discarder in order to do the waste into it. The very important thing with the discarder is that we put always 2% bleach inside it to inactivate everything we're working while we are doing it. It's very important, as I said, also to have a disinfection solution. Usually we don't use solution, usually we do this disinfection wipes where it can inactivate TB, for example, in 30 seconds. It's chlorine based, and we need also to have it inside the glove box. So after you put all the equipment you need inside, then try to close these two ports. I will show you here how to close it. I think it's not easy to show you everything, but you see this one to be sure that it's fixed, and then you screw it. What is actually these two ports? These two ports, it's one for sample in, sample out, or anything you would like to enter into the box. So we need also to be sure that you fix this in the right place. It's like you screw it in. So you need to be sure that it's fixed to be also airtight, and on the same time you have the waste bags, and then we have two waste bags. I found that I thought it's one, but you need to have always two. You need to be sure that these two are together. So I would like to address something like very important. It's for demo. We have nothing infectious here. For that, you see me, I don't wear gloves, but anyhow, if you do it, you need to be sure that you are wearing the appropriate PPE if you do that. You see, this is the waste. As you see, it's from inside, it's closed, but from outside, I need to be sure that to fix it. For that, we have a special like a gasket here in order to be sure that it's fixed in the right position. It's very important to fix this stuff because to be sure that no problem will happen while you are doing or you throwing your waste outside this small So if you face this problem, you cannot close it, for example. The easy thing to do is that like this. This is very important to keep in mind that this kind of screw, you can just take it out and you just bring it, screw it out to bring it to widen a little bit. This can be easy done, and you will have, be sure that this small part here is to this direction, and then you close and you see now it's here. And now you have double back for waste out. The first part you have here is this part. As you know, this is the upper part of the glove box. You have a small holes here where you can close it by a small stuff. I will open it for you now to know. So this stuff you can use it to close the holes. We close it from inside, and before we put it, we need to be sure that to put this small gummy stuff in order to be sure that you have a good airtight of the glove box. I will try to show it to you from inside. Here, as you see, this is a small hole. You put your plastic stuff inside. This is very important. And then try to close it very tightly to assure that it's closed. Then you try to place it in a very good position over the other part and try to secure it. Of course, you need to be sure that it's airtight. For this, you need to close it with all these locker. You need to be sure that it's fixed good and it closes all the part from all sides. So now everything from all sides is secured. Cut. So after we fix the upper part and we secure it very good and it's fixed to this part, I will show you how to fix the gloves. And as you see, we have here 2 grooves to fix the gummy, and I will show you how to fix the glove to it. It's very important. This is a nitrate gloves. It's very important to know the size. This is, for example, size 9. You must really be sure of the size, it fits you or not, because if it does not fit you, when you work inside it, you will have a very difficult feeling. And working inside the glove box is not an easy thing. And for that, you must be always aware that which side fits me, to avoid that it's too narrow or too wide and you cannot perform the required assay inside the glove box. As you see, you enter the gloves inside it. You try to really put this one on the top of it in a it's not easy, but you need to fix it very strongly, and you need to be sure that it's cover the 2 grooves. First, you bring the first gummy and try to put it in the first groove very tightly and be sure that it's inside. Then you need to bring also this gasket, which is very important to be secured here. You see, this is a little bit not secured. For that, as I told you before, you need to bring the screws and then try to make it inside to be sure that it will be very good fixed to the top of the glove. You see, it must be very secure because this is the most important thing of your work. And then you bring the other gummy and put it on the top of that. You see, two gummy, and then in the middle you have this one, and all must be on the top. Yeah, you need to be sure that it's fixed good, because this will affect your work whenever you do any work in the field. Now you bring the other gloves with the same way, nothing new. You enter this before, and then you fix it. Very good. You start from the bottom, and then you try to cover it all up the top. As you see, it's fixed. Then you have the first gummy and the first groove. You need to be sure that it's fixed, and then you put the gasket again. I'm doing this repeatedly because it's very important to know that how to fix your glove box and how to do it. You see, again, it's not secure. This is not good. You need again to open it and tighten it a little bit in order to make it working good, or fixed good, or fix the glove in a proper way to the, yes, now it's fixed in a proper way to our, yeah, now you need to be sure that it does not also, yeah, so we need to also to tighten it a little bit. It's not too much tightened. This is not good. Good. And now you bring the other gummy and put it also again to it's always very good to have somebody helping you, especially with this stuff. But now you see, gummy, gasket, gummy again, and it's fixed good, and the glove is fixed, and this is very important. Now, as you see, we have built the glove box in a complete way and have everything inside what we need. We have closed it in a proper way and have everything we need for starting our work. So if you would like to enter something into the glove box, now you have your colleague standing here. What it open first, you need to be sure that the inner cap, like this one, from inside is secured and closed. And then you open it slowly, and then you put it inside, close it very securely. You need to be sure that it's really good closed, and then you give the go to your colleague to open it from inside. Now the stuff you would like to enter it is inside this transport area. Then you open from inside after be sure that the cap from outside is secured. Don't try to make several stuff at the same time, because working with gloves inside the glove box is very, very difficult. For that, try to open it, keep it aside, go inside, take what you would like to take, and put it in secure way in the place where you would like to put it, and then close the cap very, very secure. You need to be sure it's really fixed. For sample in is via this tube port, and as you see, we can now the sample will come to me. So the colleague will open the outer cap and then just drop the sample, close it, and for me from inside I will open it, take the sample, put it into rack, and then I will securely close this port. As you see, it's not easy to work inside the glove box. For that, you need to have your full concentration. You need to have good hydration, and you have good. So now we will inactivate the virus, as we said, with an lysis buffer, which can inactivate the virus and also keep the RNA or DNA intact. As you see, we have here swabs. Sometimes you collect it into the license buffer. Sometimes you can also collect it directly in our license buffer, or what you can do is that you just collect it in BBS or viral transport media. This is the sample 1. It's written on it, it's a negative one. We know it because it's in the demo, and here a positive sample. It's always very important when you do the extraction here, you have a negative one in order to determine which contamination can happen inside the glove box if it happened. And now what we would like to do is that we can transfer. This one contained 400 microliter of our license buffer. It's prepared outside. You don't need to prepare it inside. You prepare everything outside and then bring it inside. We have one for positive sample, and we have also one for negative sample. And what we will do is that we will transfer 100 microliter from the sample into the license buffer, and then incubate it for 10 to 15 minutes into the heat block. The one thing, as you see here in the heat block is need to be adjusted to 95 degrees, and it takes almost half an hour to reach the temperature we need. Now I will show you how to transfer the sample. So it's very important to be sure that the gloves fits you. As I told you, you need to adjust your pipette to 100 microliter. Then you open it. Take the tips, be sure that it's fixed good. Then try open the negative. You always pipette at the end. As you see, it's not easy to control this stuff. And before opening the positive, you need first to open the tube which you will transfer it, otherwise you will have a problem. You see, you cannot do multiple stuff while you are inside the glove box. For that, you need to really do one at a time. So first, let's say you need to open the tube where you will put your reaction. Keep it open. Then you need to the best thing that you have two actions. Either you open, you take your tips. This might be a good idea, but you will have a problem how to catch both at the same time. For that, it's better to open the tube. As you see, the gloves not easy to work with it, but it will be good for your security and safety. And then you open this rack where the tips exist inside it. Transfer 100 microliter from this tube to the other tube. Please pipette it inside to avoid any problem or irresolve. Dispose this one, close everything very securely. In order to avoid, you see, I handled a positive sample or anything. Before going to the next sample, then please take one disinfection wipes and first disinfect your hand very good, very properly, and at the same time disinfect the tube from outside. This is very important, and you must do it every time you work between sample. You need to do it as it is, as like this, or you will have a big problem. Now you have the disposal, so you can dispose everything into the disposal bag. Okay, so it's very important to disinfect your hand in between. As you see, I'm speaking with a mask also, so for that you see that I start to not having enough air while I'm speaking to you. But this is part of the job, because if you do this work, you will do it also while you are wearing your mask. And we advise that don't work more than 1 hour inside the glove box, because you will be so exhausted, and if you are so exhausted, you will start to make mistakes, and this is not good. For that, it's better to do shifts every 1 hour, and be sure to drink enough water and be hydrated. So I will open the other sample after I disinfect my hand. Again, 100 microliter from this tube to the other tube. Close the tubes. Very good. You need to be sure this is a special tube where you have double secure, double safe, to be sure that the tube is really closed. Again, guys, you need to be sure disinfect your hand very good. Disinfect the tube from outside. And then once your heat block reach 95 degrees, you put sample inside to inactivate it for 10 to 15 minutes. So after you have 10 minute or 15-minute inactivation of the sample in the lysis buffer, as I said before, 400 microliter lysis buffer, 100 microliter of your sample, you need to take everything outside and you put it into the transport rack. Before you put in transport rack, it's very important to inactivate everything from outside, because as you see, your colleague will carry this for you, and you need to be sure that, of course, after working with this one, you are sure that after putting 95 degree for 10 minutes, you are sure that it's inactivated, but you need to be sure that everything from outside also, the virus is still alive. We'll see. And after being sure that you inactivate, disinfect everything from outside, it's very important now you take it outside. And in order to do that, be sure that the other door is open, is closed. Once it's closed, you need to open this one. Put the rack again outside and then close it again. It's very important. Now your stuff is outside. It will be taken by your colleague once you close it. And now everything is ready to do RPA or RA or any hydrothermal amplification or even PCR. What I would like to tell you here, it's very important that now I take also the rest of the sample outside if you need it. If you don't need it, you can still dispose it and throw it outside or put it with the disposal. You can do also, they think it depends on you would like to have the rest of the sample or you would like to just throw it. Okay, so now you finish your work, you would like to disassemble the glove box to take it to another region. Before doing this, it's very important to disinfect inside, and it's also very important, it's better not open the glove box before at least 1 day is over. So the first thing, do disinfect everything from interior, leave it for 1 day to dry, and then open it. Before, if you didn't disinfect anything, you not allowed to open it. Be sure that you disinfect all the equipment. So disinfect all the stuff which you are using. This is very important. Disinfect all the surfaces. Stop all the machine. Everything inside the glove box must be really thoroughly disinfected. Of course, the vortex we didn't use it, but if you would like to have a regular mix of the sample, you need to do you must really thoroughly be sure that disinfecting everything from all sides. Also, you need to be sure it's still wet, of course, and also disinfect all the surfaces. Very important, because otherwise you will have a problem of having virus hidden anywhere. So also, you need also to disinfect the waste from outside, and once you be sure also the surfaces, it's very important to disinfect all the surfaces. We really close it very good. I need to have both hands to open it. And this is good because you need to be sure. Now you have all the waste. You need to disinfect. After disinfecting everything, and then close it very good. We need to be sure that you disinfect all the surfaces. You keep it at least for a few hours to settle down. Everything is good, and then you can start to disassemble the glove box. The thing you do is to really take this out, the waste. So you need to be sure that you zip it very good, or you close it very good. This is very important. And then after you do this, you need to open all of this stuff. You need to do it while you are wearing your PPE and double gloves and everything. Only for training purposes, we're doing the easy way for this stuff. So it's very important to have the waste container, and then this waste, it depends on the regular. You just autoclave it if you have it autoclave, or incinerate it. After disinfecting the box from inside, you need to take everything, disassemble everything. Now you are disassembling the gloves. You start to open the glove box on all sides. You need to also remove the sample in, sample out. Of course, you can disinfect everything again using disinfection solution or disinfection wipes, as we used to do it. After you be sure that everything disinfected from inside using the wipes or other thing, you can now open it securely without any problem. And you have always this transport box to transport your glove box. You can have this one, or there is another one with trolley. It's very simple. Be sure that all the sides are already down, and then you just transfer it as it is into a transport box. You see, next time you start your rope, it's very important to have this foam from this side and behind it. And then the other side, the other thing we need to be to do is you put this one into the other direction. You see, it's settling here. And what usually we do is that we put, if you would like to transport any other equipment or reagent, you can just put it on the top of this one without having problem. Of course, you will have the other stuff which you take it outside. You can also still keep it inside. We usually try to fill in some other soft material in order to be sure that the stuff is secure. You can also place anything else you would like to put and close it and ready to transport it to the other side.